Hello again, my new YouTube family. Again, I'm pretty new to YouTube, and my goal is basically just to share some information pertaining to pharmacology overview and medication safety for nurses. I'm hoping that someone can utilize these notes for their own studies as I utilized it as well for my own studies, and I'm praying that it becomes something that is of benefit to someone out there who is studying nursing at current or some other healthcare related field. So let's get started. So before we start, it's very important that we talk about the introduction to pharmacology for nurses. We're going to talk about the overview of pharmacology. It's important that nurses must have a general understanding of how medication are named, their pharmacodynamics and pharmacokinetics. Medication safety is a top priority as well for us, and nurses are expected to provide safe and proper medication administration. So of course I'm going to go over those things as well. What is pharmacodynamics? What is pharmacokinetics? I will also go over medication safety and including the rights of medication administration and so on. So on this slide we talk about medication naming conventions. So medication and medication genetics, let's talk about that. Is non-proprietary drug, right? The generic name, for example, is not protected by a trademark. In the US or the United States, generic drugs are required to meet the same bioequivalence test as the original brand name drug. Manufacturers of brand name drugs produce the majority of the generic drugs and allow them to be sold without the original brand name. Generic and brand name drugs may experience manufacturing defects. Nearly half of all proprietary drugs available in the United States are also sold less expensively as the generic drugs. Name is the description. So for example, the name is a description that is assigned by the US and is adopted by the council and is identified by a lowercase letter in the generic. A medication trade name is the manufacturer registered name. The name is capitalized and treated as a proper noun, for example. So if you look at the slide, it talks about the medication naming convention. It talks a chemical name definition, describe the chemical and molecular structure of the medication, and then the generic name role is assigned by the United States Adopted Name Council. As I mentioned before, is identify a non-proprietary drug with bioequivalent to the brand drugs. And the trade name rules, manufacturer's registered name is capitalized and is treated as a proper noun. Next, we're going to also talk about high alert drug significance, medication with high potentials for harm, and if utilized incorrectly, and then common drug class suffixes. So as I mentioned, we will be defining pharmacodynamics and pharmacokinetics. And pharmacodynamics overview describe how medication produce effects in target tissue and organs. So, and then the pharmacokinetics overview explain how the body affects the medication through various processes. So just some key pharmacokinetic process. For pharmacokinetics, we look at absorption, we look at distribution, the biotransformation, and then it's excreted the excretion define medication movement and transformation. So the process of pharmacokinetic include how the body include a client's body mass index and growth and the developmental factor. Drug-related factors such as the medication route and administration therapeutic range. So it goes through an absorption, it goes through distribution, biotransformation, and then finally excretion. And then pharmacodynamics, as I mentioned, explains how the body is affect the medication through the various process, as I mentioned before. And then factors influencing pharmacokinetics is related to factors impacting medication absorption, metabolism, and elimination. Hopefully I explained that properly for you. So next we look at medication safety. And it says nurses are responsible for providing safe, quality care in every patient setting. The complexity of the healthcare environment can contribute to prospective errors. So medication-related errors are the most common type of errors and also help account for the increase in healthcare costs. Medication errors are responsible for over 7,000 deaths annually. And this is from back in, quoted from the Institute of Medicine as of 2000. So just to look at the slide quickly, even though I've already kind of summarized it, for prompts is nurses' role in medication safety. So it's important to note your role and responsibility because safety is very, very important when you are dealing with any form of medication. You can kill a person if you give the wrong medication. So it's very important that we, utilize our rights and our responsibilities. Nurses ensure safe, quality care management, complex healthcare environment, and to prevent error by all means necessary. And we know sometimes errors come from a lack of communication. Also transcript errors, medication transcribed incorrectly can contribute to medication errors. Consequences of medication errors is very serious harm to the patient, can cause fatalities as I mentioned before, and also increase health costs, and the nurse can also lose his or her license. Depends on how significant or major there are consequences that comes with that. So medication error statistic, as I mentioned before, over 7,000 deaths annually are attributed to medication error, and this is cited back into 2000. This we are in 2025 currently, and we are going to go over the 10 rights of medication administration. So here are the 10 rights of medication administration. So of course, the right dose. Check the medication label against the client administration record. And then right time. Check the healthcare organization policy for the right time to administer drug. Takes 30 minutes before or 30 minutes after the order time is usually acceptable. So you have 30 minutes before, 30 minutes after. Before we used to say 1 hour before, 1 hour after. However, we also had the 5 rights of medication administration. Now we have 10 rights of medication administration. So it's very important to stay informed and to stay current. That's basically what this is telling us. Right route, check the medication order to verify that the route is specified. As we know, we have many routes. So we want to make sure you're not giving tablet when you're supposed to be given liquid. Which is also PO both way, right? But you also want to make sure that you're not given a subcutaneous injection, IM injection. So route is very, very important when it comes to absorption and distribution. Those pharmacokinetics, right? So we want to make sure that we have the right route and the right patient, the right medication order. So right drug, check speed of infusion or push, verify accurate dose calculation, and in future upcoming I will do some drug calculation if you would like. Right client, check the client's ID bracelet and verify the name and birth date. Where available, include barcode check of ID bracelet. Have the client state full name and date of birth. Verify information using medication administration record, otherwise referred to as the MAR in some facilities. And then write documentation. Immediately after giving the medication, the nurse will document on the MAR or electronic medical record EMR, including drug name, time, dose, route, and your signature. Make sure to do a right assessment. If necessary, the nurse must assess vital signs, check client data such as lab values or other diagnostic studies before administering medication. If the client needs to swallow their medication, the nurse must also assess the client's ability to do so. As we know, sometimes after post-surgical procedure, the gag reflex as well as peristalsis has not returned. So we want to make sure we do a proper assessment before we give medication where it is necessary. Right education. The client should be taught the indication for and maintenance of current medication. We want to make sure the client is well informed pertaining to their medication, the adverse effects that they should be looking for, and we also want to make sure they understand why they're getting the medication and how they should be taking their medication. So educating the client pertaining to their medication is very, very also important. As we know, an informed customer is also always the best customer. That was Sim's quote back in the days. And then we want to do a right evaluation. So assess the client response to interventions and right to refuse medication. This is a client right. The client has a right to refuse their medication. The nurse must explore the client reasoning for refusing the medication and then should explain complication associated with not taking the medication. Finally, the nurse must document the incident and notify the client healthcare provider that the client has refused their medication. So medication administration procedure, right? Pre-administration procedure. Before administration, you want to wash your hands, assess the prescription and compare new medication prescription with current list of medication. Reconciliation, in other words. If there are questions about or inconsistency in the written prescription, the person who wrote the prescription must be contacted immediately, and the prescription verification. There's plenty of time where we have to do verification when it comes to medication administration. Maybe something is written incorrectly. We do not guess what it is. We do not try to fill it in. Your best approach is to contact the person who wrote the prescription, the healthcare provider, and verify that prescription. You do not try to figure it out by asking another nurse. The best source is to go to the source, get on the phone, get a clarification, verify, and make sure you document that this has been verified, read back and verified. Ask the client whether he or she has a history of allergies. Determine the purpose of the medication. Assess the client for existing medical disorder in which the prescribed medication is contraindicated. For example, many medications are contraindicated in pregnancy and for breastfeeding, for example. So we want to assess the client for any existing medical disorders in which a prescribed medication might be contraindicated. And then the client's age. Absorption, distribution, metabolism, and excretion of medication are affected by client's age and physiological process. Example, the older client and the neonate are at great risk for toxicity than in an adult client. So we want to make sure that we are assessing these things as well. Assess the client vital signs and significant laboratory results. For example, potassium level in a client who has been prescribed loop diuretic. Assess the client understanding of the purpose of the prescribed medication. Identify and address concern. Example, social, cultural, and religions may be a contraindicating factor. So you want to also address those concerns that the client has with regard to taking the medication. Use your appropriate resources. Example, medication formulary and pharmacists as necessary when preparing medication. Sometimes we do have questions, so we utilize our medication, our drug book, or we can refer to the pharmacist for any unnecessary medication preparation questions that we may have. It's always better to be safe than sorry. Then administration and post-administration procedure. So administration, you want to assess the 6 rights that we just went over: right medication, right dose, right client, the right route, right time, and right documentation. Assess the need for conversion or calculation of a dose when preparing medication for administration. As I mentioned, pretty new to YouTube, but definitely will do some drug calculation in the future with you. Administering medication within 30 minutes of prescribed time. Before it was 1 hour before, 1 hour after, but now they're saying 30 minutes before and 30 minutes after. Avoid administering medication with antacid, which affect absorption of the medication. Also avoid administering medication with grapefruit juice, which contain an enzyme that inhibit absorption of many medication. So we want to make sure this is not a contraindicating factor. When we are given a medication with grapefruit juice, just avoid giving medication with grapefruit juice entirely. So after administrating your medication, do not, most especially like if it's an IM medication or sub-Q medication, you do not want to recap your needle. You want to discard the needle in appropriate container using safety device provided, such as those sharp containers with the syringe if one is available. Dispose of any unused medication in accordance with agency policy. Liquid medication may be discarded in a sink or is flushed down a toilet. Now, this is not always the case with every facility. Some facilities have like a biohazard room where you go and dispense medication in their proper way of dispensing. Everything is labeled accordingly, so you might want to make sure that you know to identify with the way in which your facility dispose medication. I know flushing down the toilet in one place was not a thing, so you want to make sure that you do not throw things down the sink if it's not supposed to go down the sink, or flush down the toilet if it's not supposed to go down the toilet. There are facilities now that have hazardous room that you can go ahead and they have everything labeled in that room for you and how you should properly dispose of medication. So you definitely want to make sure that you are familiar with your facility procedures. Tablet or capsule may be flushed down toilet, is saying here, but like I mentioned before, know your facility rules and regulation. And then never discard medication in a trash container. Patient or anyone probably could go in there and take these out, and then we have problems on our hands. So never ever discard medication in a trash container. Document the administration of the medication given. Include its name, the dose, the date and time, and your initial. Immediately after giving the medication, monitor the client for side effect or adverse effect, example like an allergic reaction maybe to the medication, and take action if adverse effect occurs. It's also like very important to know what to do in situations like these, like what to have on hand and have them available in the event of low dose antidotes. What are your different antidotes? It's very important to know those things, and so it's you're able to respond in an efficient way. Then you want to evaluate the client for a therapeutic response to the medication, which is what we're looking for, and then do your documentation accordingly. So just some general guideline for medication handling. This is like critical time to double check medication. When first taking the medication out of the container, just before opening the medication package or pouring the dose, and just before replacing the container in the storage area or giving a unit dose to a client. Double check, triple check, quadruple check if you have to. But double check medication when removing it from the container, before opening, pouring the dose, and before storing or administering medication. Very, 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 very important. And then utilization of medication resources. As I mentioned before, use your resources. Use medication Pharmacology and consult pharmacists to verify information and ensure accurate medication preparation. Address the client concerns. Identify with any social, cultural prior to administering and medication, and of course adherence to compliance and safety is very, very important. Teaching, and making sure that we are doing what we're supposed to do when we're supposed to do it correctly. As I mentioned, teaching. You can't get away with that. It's very important as nurses that we continue to educate ourselves and educate our client. Educating self, teach client how to self-administer medication and monitor vital signs at home. Some medication can be really toxic, and even those blood pressure medication, safety is very important. So we want to teach them and teach them and teach. Warning against dosage changes. Advise clients never to alter dosage or abruptly stop medication without consultation by their healthcare provider. Synthroid is a lifelong time medication. That's one of them. You don't want to just abruptly take and stop. So it's very important that we teach the clients these things. Even blood thinner, you don't want to just, they have to be monitored frequently. So these are very important medications, high alert medication that we have to teach. Advice on foods and activities. Inform client about food, fluid, and activities to avoid during medication therapy. Very important. I mentioned grapefruit. Certain activities can trigger angina or something, so we want to, or even being out in the sun, can also create a problem for certain medication that they may be on. So we want to make sure that if these are contraindicating factor, that we are teaching, informing the client about everything that they need to know pertaining to their medication. Importance of medic alert, explain the necessity of wearing a medic alert identification when on specific medication, such as seizure medication, blood thinner medication, even insulin. Like, you gotta let these patient, these client teach what they need to do to be prepared in the event of a real life-threatening emergency. And emphasizes adherence and follow-up. Stress the importance of compliance and regular follow-up with healthcare provider. It's very, very important to understand, we all are different when it comes to ecological setup, but however, we can, put things in place to make it as feasible as possible so that they know that, follow-up is very, very important and compliance is very, very important. So, we teach a client about the medication and how to self-administer them if they're at home. We teach a client how to check his or her own temperature, pulse, and blood pressure, about side effects and adverse effect of medication, and when it's necessary to contact the healthcare provider. We warn the client that he or she should never change a dosage or abruptly stop taking medication. Provide the client with a list of food, fluids, and any activity that should be avoided while he or she is taking the prescribed medication. For example, for fluid, alcohol or smoking, activities such as driving that require alertness. You don't want to take something that's a sedative and go driving. It's very important. Not everyone knows what sedatives are, so we want to educate the client. Teach a client that over-the-counter medication and other medications such as herbal preparation must be avoided unless they have been approved by their healthcare provider. Explain to the client the need to wear a medic alert bracelet, as I mentioned before, or carry a medic alert card if he or she is taking a medication such as, but not limited to, anticoagulant, as I mentioned before, oral hypoglycemic or insulin, certain cardiac medication, corticosteroid, glucocorticoids, anti-myasthenic medication, anticonvulsant, and those MAOI medication. Like, we want to teach, instruct the client the importance of taking the prescribed dose for the prescribed duration of therapy, and ensure that the client understands the necessity of compliance. Stress to the client the need for follow-up with the healthcare provider is very, very important. These are some of the time where they do lab work and follow to make sure they're within the therapeutic range, and they're not toxic and things like that. There's no additional whatever follow-up need to be done and implementation may be taken. It's important that they we emphasize adherence and follow-up when it comes to medication compliance and self-administration. So next we're just gonna review some common drug classes and their generic name and ending. As I mentioned in the beginning, that we're just gonna briefly touch on these ones. So let's dive right into it. In this section, we are reviewing some common drug classes and their generic name and ending, as I mentioned. As a general rule, classes of drugs have the same generic last name, right? So it kind of helps us to know what class and what we are potentially giving to the client. So for example, pills, PRILS. We know these are ACE inhibitors, and some the slide will come up eventually where you see an example of an ACE inhibitor, such as enalapril or lisinopril. And then the sartans, SARTNS. These are angiotensin receptor blockers, and they end in sartans. These are losartan, valsartan, and then of course the triptans. These are like treatment of acute migraine headaches. And you have statins. These are the statins lower your LDL cholesterol, and then such as simvastatin, rovastatin, and then you have your dapines. These are the calcium channel blocker, like amlodipine, nifedipine, nifedipine. And then you have the prozole, proton pump inhibitors, omeprazole, and you have azoles, the antifungal like miconazole. And of course, we also have like the chemical names as well as generic names. it's very important just to know like the difference with the generic, the trade name, and the chemical name, and so on and so forth. As I mentioned, it's just an introduction to the drug class, naming conversions, and I went over them already. In a drug class, use a common name and generic suffixes, enable easy identification and interference of therapeutic effect by a healthcare professional, and then some common example of drug suffix, which I mentioned before, and I gave you some example, and I am going to highlight some more as I continue. The PRILs for the ACE inhibitors, sartans for angiotensin receptor blockers, and those cholesterol lowering agent, the statins that helps with pharmacological classes. So ACE inhibitors, the PRILs, mechanism in this slide we talk about the mechanism of action. ACE inhibitors block angiotensin converting enzyme, reducing angiotensin 2 and lowering the blood pressure. And of course it goes a little bit more depth, but this is just intro surface for the purpose of this presentation. Some common example: enalapril, lisinopril are typical ACE inhibitors, identifiable by suffix pril, as I mentioned before, and therapeutic use, primarily used to treat hypertension, heart failure by decreasing cardiac workload, and then significance of pril. The suffix pril helps the healthcare professional recognize drug in this class. So for angiotensin receptor blockers, the ARBs are sartans. Mechanism of action: ARBs selectively block angiotensin 2 binding to the ATI and receptors, preventing vasoconstriction and aldosterone release, resulting in vasodilation and lowering the blood pressure. Some common examples are losartan, as I mentioned before, valsartan, widely used ARBs, identified by the suffix sartans, which denotes their drug class, and therapeutic use, treat hypertension, heart failure, diabetic neuropathy, and serve as an alternative for patient intolerance to ACE inhibitors. As we know, with ACE, it can cause that dry hawking cough, indicating angioedema. So at that point in time, the provider may switch out the client to one of the sartans. So we definitely just want to just know these things, because it's like very important. If someone call and say, hey, I'm on this mess, and I'm and I am getting this horrible cough, we should be able to identify that ACE inhibitors cause these effects. So we want to say it's an emergency, come on in, so that they could be seen by the healthcare provider. So acute migraine treatment, the triptans. So role of triptans in migraine management. Triptans treat acute migraine by stimulating the serotonin receptors, causing brain blood vessel constriction, and reducing migraine triggering substance. And then examples and clinical use of triptan. Common triptan include sumatriptan, and you can see it ends in triptan, so it's easier for you to identify. Rizatriptan and zalmatriptan. During acute episode with caution in cardiovascular patients. So we use these during the acute episode, the triptans, for migraine treatment. So cholesterol lowering agent, the statins, the mechanism of action: statin inhibit the HMG CoAG reductase, is an enzyme, so reducing cholesterol synthesis and increasing the LDL. This is the good cholesterol uptake from the bloodstream. And then common statin example includes simvastatin and rovastatin, widely used to manage high cholesterol and reduce cardiovascular risk. So we have the bad cholesterol and the good cholesterol. Healthy cholesterol with HDL, and then LDL, it's bad cholesterol. So we're gonna know the difference between them both. I know them by using HDL as in healthy cholesterol, so you know which is which. So just want to, I think I made an error, so I just want to correct myself. And in reading, it really kind of threw me off a little bit. So reducing cholesterol, so the statin inhibitors, HMG-CoAG reductase, reducing cholesterol synthesis and increasing LDL uptake from the bloodstream. And as I mentioned before, this is the bad cholesterol, so definitely want to increase the uptake from the bloodstream, because a buildup of this can contribute to plaque buildup in the blood vessels, and we don't want that. We want to increase the HDL rather. So just want to make sure that that's corrected. And then some common statin example includes simvastatin and rovastatin, widely used to manage high cholesterol and reduce cardiovascular risk. And as I mentioned before, statin lowers the LDL cholesterol, which is what we want, lower LDL and increase the HDL. So it helps lower LDL, slow arterial sclerosis progression, and prevent heart attack or stroke. So here is our calcium channel blocker. Ends in dapines. So what we're looking for is the dapines. All right, as I mentioned, I went over those earlier as well. So the mechanism of action is calcium channel blocker inhibit calcium iron influx through L-type channel, causing vascular smooth muscle relaxation and vasodilation. Calcium channel blocker, basic use of medication like amlodipine, for example, verapamil, for example, is also these are calcium channel blocker. Use and identification: these drugs include are used to treat hypertension, angina, and the suffix, as I mentioned, is dopine. These are the prozol. These are proton pump inhibitors, and they're also known as gastric proton pump. Is an enzyme primarily that is found in the parietal cells of the stomach lining, otherwise referred to as the gastric mucosa. Its main function is to acidify the stomach content, which is also pretty crucial for digestion and activating the digestive enzyme that is pepsin. So proton pump acts as a pump transporting hydrogen ion, the protons, from the cytoplasm of the parietal cells into the stomach lumen, while simultaneously bringing potassium ion from the stomach lumen into the cytoplasm. And this process require ATP, the energy derived energy, the energy of the cell. Yeah, the energy is ATP's energy of the cell. Let me see, what else can I mention pertaining to this? So I already mentioned significantly reduce gastric secretion. Some drug representative, omeprazole is commonly used as one of those proton pump inhibitors. It's just as an example for a drug class. And then, as I mentioned, it's effectively manage acid reflux and peptic ulcers. So some clinical indication identified for proton pump inhibitors are for like GERD, ulcers, and ulcers. And of course, I'm mentioned over and over, it just helped to reduce gastric secretion. So just expand a little bit on the slide. So antifungal agent azole, mechanism of action, inhibit ergosterol synthesis, disrupting fungal cell membrane and preventing fungal growth. So metronidazole is commonly used topically for skin infection and also available oral and vaginal for fungal infection. And then, of course, broad spectrum of activity. Azoles are effectively against Candida species. Just to list the one. So thank you so much for taking the time to just help me with this slide. Just watching, I appreciate your help and just your contribution to the healthcare field. I am new to YouTube and I am just trying to share some information that I utilize for my own study. And another thing is, one way in which we can also teach ourselves is by trying to share your own information with others and therefore reinforcing that information for yourself. So this is just a method to also teach myself as I share with the public.